Hello, my name is Jones, and today we are looking at the mental health aspect of HIV. Okay, so HIV or human immune deficiency virus is the virus that causes AIDS. HIV attacks the immune system by destroying CD4 cells, okay, which are a type of white blood cells that help in fighting infection. The destruction of these cells leaves a person who is infected with a lot of vulnerability to infection and other complications. Alright, so now people with HIV are at higher risk of mental health disorders or problems. For instance, if someone is living with HIV, it's important for them to be aware that an increased risk for developing mood, anxiety, and cognitive disorder is common. In other examples, living with HIV makes someone twice prone to likely have a depression as compared to those who are not infected. Of course, these conditions are treatable, and many people with mental health conditions within HIV, they recover completely. Okay, so some of the forms of stress that can contribute to mental health problems of people living with HIV include having trouble getting the services that they need, experiencing a loss of social support that results in isolation, experiencing a loss of employment or worries about whether one will be able to perform their duties like they used to perform before. Also, having just to tell others that they are HIV positive might be difficulty. Of course, other challenges include managing also the HIV medicines, going through changes that may be accompanied with the disease in terms of physical appearance or abilities that might be altered because of the disease. Other challenges or stressful events within HIV is dealing with the loss, including the loss of relationship or even death. Okay, and lastly, the other type of stress that may be faced is the issue of stigma and discrimination, which is associated with the diagnosis of HIV. Okay, so now it is also important that other mental health problems may arise because HIV crosses the blood-brain barrier, so it can affect the brain and lead to cognitive conditions such as dementia. Right, and then there is also another condition that can be seen, of course, related to mental health problem. Okay, this condition is known as HIV-associated neurocognitive disorder. Okay, disorders. So it is abbreviated as HAND. HAND. Okay, so HAND represents a range of neurocognitive complications associated with HIV infection. Although there is currently no cure for HAND, combination of antiretroviral therapy has shown to be the only option in preventing or delaying the progression of HAND. So basically there are three major types of HAND. So there is asymptomatic neurocognitive impairment, abbreviated as ANI. So this is diagnosed if testing shows HIV-associated impairment in cognitive function, but everyday functioning is not affected. Then there's also what is known as mild neurocognitive disorder, which is abbreviated as MND. It is diagnosed if testing shows HIV-associated impairment in cognitive functioning and mild interference in everyday functioning. So that is in mild neurocognitive disorder. Then we also have the third one underhand, which is HIV-associated dementia, abbreviated as HAD. This is diagnosed if testing shows marked impairment in cognitive function, especially in learning of new information, information processing, and attention or concentration. This impairment significantly limits one's ability to function in a day-to-day work or home activities or during social activities. So we are saying there are three major types of hand. There is asymptomatic neurocognitive impairment, and there's mild neurocognitive disorder, and HIV-associated dementia. Okay, although a significant proportion of people living with HIV are affected by a mild form of hand, there has been significant progress in the treatment of hand. Since the start of the epidemic, severe cases of hand have been on the decline, and the most severe form, which is hard, that is HIV-associated dementia, is quite rare. The majority of people experience more subtle abnormalities in memory and cognition. To sum up this lesson, the mental health aspect of HIV can be abbreviated within, or can be remembered within a mnemonic SHAD. Okay, so this mnemonic simply puts to list some of the mental health condition that someone may face because of HIV. So the first one is suicidal ideation. Someone may be facing this because of loss of employment, loss of income, that may be associated with CCOVs that they might be having. Then the other part is stress. So stress, for this stress may lead them to having some kind of stress crisis because it is difficult, or somehow it is challenging to adapt to taking the drugs and keeping records of review dates. So they become stressed, so they may end up having a stress kind of crisis. Of course, with stress sometimes comes sleep disturbances. So this is another mental illness that can be seen, or mental health problem that can be seen, which is to do with sleep disturbances. Then the next part in our SHAD, that is H is for hands, that is HIV-associated neurocognitive disorders, which I've mentioned already. All right, so other problems or mental health problems that may be faced in HIV include anger, mostly to come because of isolation, okay, and the mood instability that may come. Okay, so now in our shade, D is representing a lot of other mental health problems or illnesses that may be seen in HIV, and that includes depression. Okay, depression that may be associated with other challenges that one is facing within the condition. And then the other part is drug abuse. Injectable drug abusers, when they're using these drugs affect their central nervous system. So it will affect their judgment. So if they start sharing the needles because of that age to use the drug, drug that they are abusing. They may find themselves injecting themselves with infected needles. Then the other part is drugs. There are some antiretroviral drugs that affects the CNS. Here, the best example I can give is efavirenz, which affects the CNS, and when it has been prescribed, it is important to take history of mental illness within that family. Okay, so now the other part is discrimination and stigma, or stigma and discrimination, because one fails to review to others as to why they might be having a lot of sick coughs, maybe at work, to necessarily telling them, oh no, I'm HIV positive. It is something very, very difficult. So the issue of stigma and discrimination may come in. Of course, the last part in the mental health aspect of HIV includes dementia. Okay, dementia, that is the disease may affect the CNS. Okay, the disease may affect the CNS, and someone's memory may be affected. Of course, when I say dementia and disease itself, we can say also the disease process itself, because it crosses the blood-brain barrier, can be associated with mental illness, because once the brain is involved, mental perception and judgment is going to be affected. So thank you very much for listening to this lesson. Please ensure you subscribe so that when we post new videos, you'll be able to be the first one to watch, and also click the bell icon so that you are notified immediately we post new videos. So thank you very much.